In 2010, Michael Marmot published his review, which really drove home to GPs and clinicians that the majority of the determinants of health outcomes happen outside the consultation room. Social prescribing allows us to help people connect to their communities, help them to prevent illness, and help them to motivate themselves to address lots of different things that can affect their health. And until recently, we've not had a really good way of addressing that. Social prescribing is an umbrella term, and if you look across the country, there have been loads of different schemes. So the exciting thing to me is that we can work to local priorities for local networks. What we see now is lots of different models of social prescribing, the ability for local solutions for local populations. When the opportunity came for our health partnership to respond to the Department of Health's challenge to provide social prescribing for our population, we looked around to see who we could work with. What we see with Health Exchange, our partner in developing this social prescribing scheme, is an organisation with the skills already there. They provide social prescribing in other parts of the city. They've got a track record in developing health and wellbeing services.
Social prescribing has been something that Health Exchange has done for many, many years now. There's a whole range of different activities that we can refer people to. Those can include art, music, singing, tai chi. It could be anything that the individual needs. Often it's also about advice and support. So it might be the socio-economic issues that are causing them a few problems, so we can support them in that and signpost to the right organisations.
In your networks, you can choose to use health and wellbeing partners in different ways. You may choose that they come to each of your surgeries and do clinics at specific times, or you may choose that they offer a centralised service with the drop-in facility.
The healthcare team can expect health and wellbeing partners to be professional, holistic and person-centred. We can give patients the time and the space to really feel at ease and like they've been understood. If a client is identified as needing some help, then a referral can be made directly via the GP.
However, other GP staff like receptionists and maybe even nurses can also make that referral.
Or they can indeed self-refer. Once that referral has been made, the health and wellbeing partner will make contact with the person and arrange for an assessment.
I would say to GPs, practice managers and all staff in the surgery, please become aware of how to refer to social prescribing. We've made it as easy as possible so that any staff member can refer a patient towards the service.
A client that I recently supported who was struggling with the emotional after effects of a stroke. She was quite isolated anyway, so I worked with her to find a stroke support group, and that led to her actually seeking out those friendships that she may have isolated herself from. We also helped her to access the patient and liaison service, and that gave her a lot of confidence as well.
For GPs and practice staff, it's not often that we get a service that is aimed to take some of the burden away from our day-to-day practice. Getting as many patients through the social prescribing service, you will see more and more impact in your day-to-day practice. Really embrace this because it's an opportunity to help us day to day and most of all improve the health of our patients.